We have a CBC News hidden camera investigation next of a for-profit mobile health clinic from the United States that has popped up in Manitoba. It is offering diagnostic tests out of local hotels, prompting the health minister to order a review. Caroline Bargut reports.
A hotel isn't exactly where you'd expect to get a medical test done. But in Steinbach, Manitoba, a community about an hour outside of Winnipeg, a CBC News producer is on her way to get an echocardiogram.
We're just kind of getting set up here.
It's a diagnostic test that checks a patient's heart. And in this province, the wait list for non-urgent cases is currently 14 months.
All ultrasound, so no radiation.
But for $400, Access Health Imaging, a North Dakota-based company, has been offering an echocardiogram to anyone who wants it, whether or not their doctor deems it necessary.
I think there's a number of concerns, not the least of which is the financial cost.
Winnipeg-based cardiologist Dr. James Tam says these companies are preying on patients' fears, and that could cause more harm than good.
Now, patients are sometimes concerned that they might develop a heart attack, and so they go for a screening test. But the test can tell whether they've had a heart attack. It cannot tell whether or not they're going to have a heart attack. So that same patient may be reassured falsely that they have no risks, which is not true.
Dr. Tam says physicians don't just rely on diagnostic test results to determine a patient's risk. They also do examinations and look at the person's medical history before drawing conclusions.
Health Canada says provinces that allow echocardiograms to be offered for a fee breach the Canada Health Act. Years ago, a similar company set up mobile clinics in Winnipeg and British Columbia, but they were shut down. BC went as far as getting a court injunction to make sure they weren't operating.
There are very good medical indications for echo.
This Ontario-based cardiologist says companies like this are coming into Canada to fill a void caused by inadequate health care.
This has been going on for a long time in Manitoba. It's an outlier in Canada, and this should be, I think, a call to all those involved that there's some urgency to get this fixed.
I have a few more clinics in this area too, so I'm hoping to get the reports mailed from this side of the border.
A few days after CBC went to the mobile clinic, we tried getting in touch with the company, but the phone had been disconnected. All other efforts to reach the woman running it were not returned. Federal officials say since the people involved with Access Health Imaging are not Canadian doctors, it's up to the province to deal with it. Manitoba Health says it had no idea the American company was here performing tests and has ordered a government review. Caroline Bargut, CBC News, Winnipeg.